Hello, my name is Benedikt Schrage. I'm a cardiologist from Hamburg, Germany, and also a cardiovascular researcher. And I conducted the recently published study Association of Iron Deficiency with Incident Cardiovascular Disease and Mortality in the General European Population. So basically, from trials in disease cohorts, for example, from heart failure trials, we do know that iron deficiency, and especially functional iron deficiency, is linked to the outcome, so the morbidity and mortality of patients. And we also do know that interventions, so supplementation of iron in iron deficient patients, is linked to better symptomatic outcomes. But this seems to be also true for functional iron deficiency, which means assessing the stored iron and the iron in circulation, instead of just assessing the absolute iron deficiency, which just uses the stored iron. However, in the general population, until now, we have only investigated associations between absolute iron deficiency and outcomes, but not functional iron deficiency and outcomes. So our aim was to provide a very comprehensive assessment of iron deficiency, functional iron deficiency, and absolute iron deficiency with mortality, cardiovascular mortality, and incident cardiovascular diseases in the general population. So for this study, we used the BioMarCare consortium. BioMarCare is the collaboration of several population-based study cohorts in Europe. And we were able to use data from 3 cohorts, which provided baseline information on the iron status, which was needed to assess functional and absolute iron deficiency. So in the end, this was a study of roughly 12,000 European patients or participants who were apparently healthy. So this was no disease cohort, but participants randomly selected from the general population.